Many people base their position on the issue of abortion based on value-based claims such as religious and political stances. I am not here to argue pro-life nor pro-choice, but to provide factual reasons why it is important to understand that limiting access to abortion will threaten the physical and psychological health of women. A woman with cancer during pregnancy increases physical harm to both the fetus and the woman. For further understanding, I present to you 31-year-old cancer patient I will refer to by the initials JB. JB was diagnosed with breast cancer in December of 2002 at St. Joseph's Hospital in Orange. JB was diagnosed with breast cancer in December of 2002 at St. Joseph's Hospital in Orange. As part of the pre-treatment plan for any female cancer patient within childbearing years, a pregnancy test is required. Her test resulted positive. As a result, her and her spouse were faced with life and death choices. First is delay treatment to avoid malformation of the fetus, possibly risking her health. Abort the pregnancy to further go any form of treatment, whether it be radiation or chemotherapy, or choose chemotherapy or radiation treatment while being pregnant, risking deformalities of the baby. If the decision were to delay treatment until the baby is born, the cancer could grow and spread to an extent that both treatments could only prolong her life but not cure her from it. The consequence of foregoing treatment during the pregnancy will cause the baby to live with deformalities for the rest of its life or possible death. Also, the mother could take on feelings of guilt and stress because she caused the deformalities. By choosing to abort the pregnancy, the woman is offered a best chance of survival. With that, if abortion had not been available, the outcome of JB's journey would have been gravely different. In comparison, harm to the psychological health of women will become present if abortion is restricted. This can be seen in any woman who becomes pregnant after being a victim of rape. In a prospective study, it has been proven that 94% of rape victims suffer from post-traumatic stress disorder, PTSD. When pregnancy results from rape, PTSD can negatively affect a woman to the point where she lacks taking care of herself during her pregnancy, therefore negatively impacting the development of the baby. Examples should include improper diet or lack of eating and substance abuse. Additionally, a rape victim's difficulties with being touched will result her in unwillingness to see a doctor or physician. There are also damaging effects during or after the pregnancy. According to Children, Youth, and Women's Health Services, most women have experienced flashbacks of their rape in midst of labor and have had difficulties with breastfeeding. No one wants to revisit or be reminded of such feelings experienced during such a traumatic experience in their life. These situations have potential of agitating the psychological disorder caused by the rape originally. Having a child after being a victim of rape, has potential to cause poor parenting due to the possibility that the child could remind the mother of the incident. Child neglect or abuse could be reflected in the relationship between the woman and the mother. The baby and the mother. Giving women access to abortion opens doors to healthier decisions both physically and mentally for the mother. I hope that you will all agree that limiting availability of abortion will in fact threaten the physical and psychological health of women. Thank you.
All right, well, you identify the topic very clearly, and you've got a good statement of the proposition, except that you've also kind of included the two supporting points in the proposition, so that's a little bit awkward. On the other hand, that does mean that you've got a preview, so we know where you're headed with this argument. I think you need to show a little bit more controversy on this issue. For example, is there any data that suggests that abortions are being restricted in this particular field? For women who have health issues, or for women who are the victims of sexual assault, are there proposals to restrict access to abortion for people who fall in those categories? I think that that would suggest then that there is really something that's problematic here. Otherwise, it seems kind of speculative that you're talking about an issue that may, in fact, there may be no controversy on. A lot of people who oppose abortion might grant exceptions for the very things that you're talking about. I thought that your internal signposting was fairly clear, and it was easy to follow those points. You start off on the first point with a nice example. There's a lot of detail on it. The thing that you need some follow-up on is some information about the frequency with which people who are pregnant might have these kinds of life-threatening decisions to make. You've got one good example here, but is that enough to make a generalization from? There's no statistic backing that particular point up. On the second point, when you're talking about the trauma that's involved and you've got the post-traumatic stress disorder that you discussed, there's some statistical information on that. So I don't doubt that there's a lot of potential problems for rape victims in those situations. The link to a pregnancy that results from that is talked about to some degree, and you've got some experts that are discussing the way somebody might be affected by that. Again, that is all hypothetical in nature. You don't have any particular examples. There are a couple of pieces of factual data that you stuck in there that describe some of the things that women might be faced with. I thought you did an okay job citing sources for the information that you presented, but you probably need some additional information about the frequency with which this occurs again. As an issue, we're back to the same point. What is the likelihood that any restrictions on these kinds of abortions would occur? And do we have any examples of it occurring, or any data of women who have given birth subsequent to being raped that would support the illustrations that you're talking, or support the inferences that you're making? I thought you did a nice job making audience contact and pacing your presentation just about right. All right. Thank you.